question is the bill be now read a second time. The member for Hughes.
Thank you, Madam Acting Deputy Speaker. I welcome the opportunity of speaking on this bill because this bill is of a concern to an increasing number of Australians, especially those older citizens in my electorate of Hughes. My electorate includes that area of the western part of the Sutherland Shire which makes up about 70% of my electorate and extends further west to include the Liverpool CBD and the Liverpool suburbs of Chipping Norton, Moorebank, Holsworthy, Hammondville, Wattle Grove and Pleasure Point and Voyager Point. Across the electorate, there are several superior aged care facilities that provide for the needs of our senior residents in a variety of modern, high-quality accommodation styles in which they receive high-quality professional care. And I would like to acknowledge the excellent service provided at Hammondville Homes at Hammondville, Scalabrini Village at Chipping Norton, Thomas Mitchell Nursing Home at Illawong, John Paul Village at Heathcote, Thomas Holt Retirement Village at Kirrawee, Chesalon Nursing Home at Janali, Warina Gardens at Bangor and Lark Ellen at Sutherland. In striving to ensure that the provision of aged care is of the best quality and delivered to aged residents under the principles of the world's best practice, this bill seeks to amend the Aged Care Act of 1997 and the Aged Care Bond Security Act of 2006 to address inadequacies identified in the current legislation and to provide for the maintenance of effective regulatory safeguards to ensure the best quality care continues to be delivered for our older Australians. The former government's reforms placed significant emphasis on delivering a high-quality, affordable and accessible aged care system. The previous coalition government's reforms began in 1997 when the new Aged Care Act 1997 and the Aged Care Principles introduced a unified residential care and payment system. The Aged Care Act 1997 is the main legislation that regulates the provision of aged care in Australia. Also introduced at the same time was a national quality assurance framework for residential aged care, combining accreditation, certification and the Aged Care Complaints Investigation Scheme. Many Australians are already aware that we have a real challenge in the provision of aged care services in the Australia of the future because of the expected increase in the number of ageing Australians. This is often referred to as the greying of Australia, as older Australians become the dominant cohort in our demography. Currently, there are over 2.8 million Australians over the age of 65, and approximately half of those require some level of assistance in their daily lives. This is expected to increase to 7 million people by the year 2047, or 25% of the population. In my state of New South Wales, the population projections were released this week, and those over the age of 65 are expected to increase by 111% by 2036. So it's not necessary for me to add that this greying demographic is presenting a massive challenge for all levels of government in Australia. This ageing cohort is going to have a significant impact on how aged care services are delivered in the future, not only how governments will respond to the increased demand, but also the growing diversity of care needs of older Australians and their individual preferences due to the differences in personal affluence. These and related aged care issues are discussed in recent papers that have been released to contribute to the discussion, and I refer to two: the Productivity Commission research paper, which looks at trends in aged care services, and the Grant Thornton Aged Care Survey. The Productivity Commission, in its research paper entitled Trends in Aged Care Services, Some Implications, analysed major trends in both supply and demand for the next 40 years. The Commission identified a number of challenges for the future, including increase in demand, the required care needs and the workforce that will be required to deliver services for an increasing number of ageing Australians. The Commission identified that the significant increase in demand for aged care services in the future is a result of both a sizable decline in fertility rates since the 1960s and an increase in life expectancies through the advances in medical technology and public health initiatives. Those aged over 85 are the main user of aged care services, and their numbers are expected to increase at least fourfold by 2047, and that will present a massive challenge for all levels of government again. Care needs are also expected to change. It is expected that the shifting pattern of disease and infirmity amongst the aged is going to increase the proportion of frail older people with more complex care needs. For example, the incidence of dementia and Alzheimer's are expected to increase amongst the aged population. We are also seeing an increased preference for independent living apartments by senior citizens as they exercise a desire for greater autonomy and choice in their lives. Independent living, because of the government's policy of ageing in place, can be supported by community care packages as our seniors advance in years and become more frail and dependent on support. These changes in care needs and demand for services, along with the challenges arising from a tightening of the labour market over the foreseeable future, will have serious implications for the aged care workforce. The Commission says that the evidence suggests that over the next 40 years there will be difficulties in securing an adequate supply of personnel with the necessary skills to support the delivery of aged care services. This is going to be accentuated by competing demands from the acute care sector and other industries. The Grant Thornton Aged Care Survey looks at the impact of changing demand on the aged care industry. It received responses from 686 facilities, representing almost 25% of all facilities in Australia. It looked at performance of the facilities, building costs of new facilities, demand for services, funding and service quality. The service looked at earnings before interest, tax, depreciation and amortisation per bed. Unfortunately, the trend in provider performance is declining. It is stated that this is due to the cost escalating faster than the increases in subsidies. Increased building costs of new aged care facilities